FCPS is committed to the health and safety of our students and staff. We are working closely with the Frederick County Health Department, the Maryland Department of Health, and the Maryland State Department of Education to monitor the status of COVID-19. The primary goal is to minimize the spread of COVID-19 in Maryland. My guest today is Dr. Barbara Brookmeyer, head of the Frederick County Health Department. Dr. Brookmeyer, we really appreciate you taking the time to join us today. I don't have to tell you that the coronavirus is a hot topic in our community. There are lots of questions, lots of fears, and I think a lot of misinformation out there. So we appreciate you being here to help us understand this better.
You're welcome. I'm really glad to be here.
So can you tell us what exactly is a coronavirus and COVID-19?
All right, so the brief summary, and I know a lot of people have been reading a lot about it, so I won't go into great detail, but I think it's important for people to know that the coronaviruses, so it's a family of viruses, and the new novel or new coronavirus is one of 7 that are known to infect humans. And so we've all already been exposed to probably at least 4 coronaviruses, and that's because they just get called the common cold. So we actually have been exposed to coronaviruses already, but the reason why this one, the novel one or the new one, new to humans, is of public health concern is because since we haven't been exposed to it before, it means that our immune systems don't have the ready-made weapons to fight it off at the first detection of the infection having invaded our body. And so if we don't have the ready-made immune cells, either from vaccination or from a prior exposure to it, a prior illness, then our immune system, it takes about 2 weeks for it to mount an effective response. And so when we're talking about a new virus that we haven't been exposed to, in that 2-week time till your immune system is figuring out, oh, what's the best weapon to try to fight this? Well, you've already had the infection. And then there's the concern that potentially you've spread it to other people while you were sick. And so those are always characteristics that do make us concerned in the public health community. So our interest is to try to either stop it or contain it, so prevent additional infections. And in our global world, that is very difficult to do with all the travel that we have. So our idea is to first try to contain it as much as possible. Then we for sure then are looking at implementing what's called community mitigation strategies. And so that's just another term to say finding out ways to try to slow the spread in the community.
And in Maryland, that has been our focus because the first cases that we've seen have mostly been travel related. Mm-hmm. And so the efforts that I know the state health department and our local health department are making are, let's try to minimize the possibility of this spreading. And I know that one of the things we've been emphasizing in our schools, and you've been emphasizing with the whole community, is taking the normal steps you would take to prevent any illness, virus, cold, flu, during the season when colds and flu are running rampant. And so let's talk a little bit about what are those best prevention strategies.
The risk of somebody becoming ill from the novel coronavirus requires them first to have become exposed to the coronavirus. And the main ways that people get exposed are either from the respiratory secretions, so coughing, sneezing, or when I'm talking. So when I'm talking, the spitting that I might not realize I'm doing right now, it should not be landing on you or on your mouth right now, but that is something that when people are very close and they might cough or sneeze on someone and say, I think we've all probably experienced it, you're talking to somebody and you feel something wet land on your lip, well, or if it lands on your nose, and then say you rub your nose, well, you might actually just be pushing that virus right into your nose from that respiratory spread. And it doesn't linger that long in the air, so unlike some infections where it can stay for a long time and also travel a long distance, so that's one of the areas where we're a little more fortunate with this case. The other way that people can get the virus into their bodies, besides that airborne respiratory, is they touch a contaminated object. But even if an object is contaminated with, where somebody coughed, so say this table, for example, I don't have to worry about this table. I haven't touched the table, assuming I haven't just touched the table. But so if I don't touch the table, doesn't matter that that surface is contaminated. Now, once I touch the table, so say my hand does pick up the contamination, it's still not a big deal until I touch my mouth, touch my nose, touch my eyes. Then I'm potentially putting the contaminated material into my body. I'm giving it away to get in.
And I do think in our conversations about washing hands and not touching face, I know I have begun to realize how often my face itches. So really working on just that discipline not to automatically reach up and touch.
Right.
So self-awareness is key.
Yes, and now that you just said it, now my nose itches.
Mm-hmm. So we have had some parents who have thought that if they buy the surgical mask and they send their child to school with a mask, that's going to be a good prevention strategy. So can you talk a little bit about why that isn't on any of the list for recommended practices?
Right. For a number of reasons, wearing masks for people whose healthcare provider didn't recommend it. So there are some people who their immune systems don't work well, either because of the medicines they take or because their health conditions. And so their healthcare providers might be recommending that they wear a particular kind of a mask. But even then, it's not 100% effective. And wearing these masks can also give a false sense of security and perhaps lead to lax awareness of an intention on trying to prevent other ways of becoming contaminated or infected. So the masks that people are wearing, so there are the N95 respirators. They're technically respirators and need to be fit tested. And those types of masks, they are in short supply for the healthcare providers. And so we do ask that the public not hoard those supplies, not burn through those supplies and try to buy as many as they can, because the healthcare providers who are at higher risk because they're in very close contact with people, or potentially what we're looking at, going to be in very close contact with people who are infectious, and we want them to have the best protection available. So then when you're talking about the other types of masks where it's loose, it's just around the nose and it's loose around the face, well, one, the masks that people get, they might not filter the right size to even prevent the virus from coming in right through the mask. Then there are the gaps on the side that virus particle can still get in. And then there's the potential for whatever's on the mask, somebody touches the mask, if they had something airborne, so maybe it's on the outside of the mask, well then if you touch your mask, either just because you're touching it, you're readjusting it because it's so uncomfortable, and especially if we think about kids, very uncomfortable for them to wear a mask all day long. So then they're touching it to readjust it so that they can talk better, maybe pull it down so they can breathe better around, so that their nose isn't covered. Well, now whatever's on the outside of the mask is contaminated. And then just like we talked about, people are constantly touching their eyes, rubbing their eyes, their nose. So the mask could actually be contributing to somebody actually taking contamination, putting it on. And then, of course, like we talked about, then there's the potential for touching a contaminated object in addition to the mask, but some other object, and then again touching the eyes, nose, face. And so there's the stigma that is very real, especially for people who, if they haven't been wearing a mask all flu season long, and we still have widespread influenza activity. So people who are at particular risk have probably, that they haven't stopped, when it became March, they didn't stop taking those measures because flu was still widely circulating.
And so, as you said, we have the flu, we have colds that are around. What should people do if they are starting to see some symptoms and they're not sure? They're thinking, oh, maybe this could be coronavirus.
Right.
Your advice there.
Right. And we have to add the allergies that people are concerned, because we didn't have that. Because of the way our winter was, people are concerned about an early allergy season and a longer allergy season, and many of those symptoms are all the same. You don't know. Is the runny nose just because of allergies? Is it because you're starting to get a cold? What the situation with the novel coronavirus, at this point, we don't have any information to suggest that the novel coronavirus has been spreading in the community. At this point, it's been the travel-associated cases. And so I realize when this is taped, it could be when we leave here today, we'll have new information. But I can say in the Frederick area, we don't have any information that suggests that it's circulating in the community.
So what about our school nurses and our health room technicians? Are they prepared to identify COVID-19 and to give advice to our students and their families?
Yes, so in the health rooms, so the staff working in the health rooms have the same screening information that the medical offices have, and so the benefit of them being associated with the health department is we've recognized sooner rather than later the benefit of having a screening tool. I know I'm getting questions today from some offices asking, should we be screening people? So the good news is that the staff in the health rooms have gotten the information right away and are being kept up to date with the changes in the questions to the screening based upon new information coming in and based on including what's been known from the research worldwide as well as what's going on in Maryland and in the local community.
And speaking of the research worldwide, I know that when you present it to our administrators, because we wanted to make sure our principals and our central office leaders were as up to date as they could be. As you said, things tend to change, but most of the research right now is indicating that children are kind of low risk when it comes to the coronavirus.
Yes, so that's where it's really different from influenza. And so it's an area of active investigation right now. Then I know that there have been questions about, well, are young persons getting infected and just not becoming really ill? That might be the case. But what I've read about research looking at households in China, it appears, so the early research, it appears as though the children in the families are becoming infected from the adults, not vice versa. So it might be that for children that there is, for some reason, they are less likely to develop illness or maybe even less likely to become infected because their bodies are fighting it off right away. I'm not sure, but that is where it is very different from influenza.
Okay. And so, as you said, I know you are getting a lot of questions. We're also getting questions, and one of those questions is, well, when will you close schools? And I am very fortunate because I can always say this is a public health issue and we need to follow the advice of the experts. And here she is, the expert. What are the kinds of conditions that you would be looking at that would make you say to me, Dr. Albin, maybe it's this school, maybe it's this area, or we really think the whole school system needs to close?
Right, I know that's the question that everybody wants to know the answer to and wants a definitive answer that will work in all situations. And so I appreciate your and everybody else's recognition that it's just not that simple and we don't have a crystal ball. And I would say, so other people are probably familiar with what they've heard in some of the news reports from other places in the United States. We have some examples already where some schools have taken some actions. Again, what's going on in their communities has been very different. But so we have the benefit that we're not the first, so we will benefit from their experiences. And I very much appreciate being able to take into account what's going on elsewhere. And then, for you and I, then we will also be weighing heavily on what the guidance is coming from the State Department of Education, and from the State Health Department. But I really appreciate our close relationship to make sure that we're aware of what's going on and to try to have a rational basis that's defensible, that is grounded in science, and that before anything is done, that we think about how might this play out, who are the stakeholders, what are the pros and the cons, and I appreciate your deliberative process on that.
Well, and I really appreciate being able to reach out to you and ask those questions. And we've talked through some scenarios. For example, what about these out-of-state field trips with so much being unknown in other parts of the country? And so I think it's also important for the public to know that, again, you and I talk frequently. but you also are constantly on conference calls with, national experts, looking at what's going on all across the country, and as you said, learning from what's happening elsewhere. And I know there are state conference calls, superintendents are regularly talking, and we have a conference call scheduled so that we can all keep each other informed and try to make decisions that are based on solid information. Because I think one of the things we've also seen with this, as you were presenting to principals yesterday, you talked about the SARS virus, and we had the H1N1. The anxiety in our community around this is so heightened and so elevated that I have to think social media and some of the 24/7 news cycles where people are just constantly bombarded with this word, the coronavirus, that it has elevated the fear to levels I don't remember seeing before in education as we've navigated through some of these other kind of novel virus situations.
I would share that assessment, right. And so for people who are having, who are experiencing anxiety or some level of discomfort, we're very fortunate in Frederick that our local 211 call center is operated by the Mental Health Association, so they're experts in helping people manage and deal with uncomfortable feelings. And 211 is also the number that the state has started using for coronavirus general questions that people have.
Absolutely, and we continue to communicate, and I know you do as well, the reliable sources of information that we want everyone to follow. So again, we appreciate your calm, reassuring leadership as we navigate through this, and the time that you have given. You are always so responsive to help us as an organization make sure our employees are prepared, and now also hopefully many members of our community who are worried about this and needed to get some details from the experts. So thank you so much, Dr. Brookmeyer. We really appreciate it.
You're welcome. Well, I'm glad to have this opportunity, and good to see you again today.
We just heard valuable information from Dr. Brookmeyer. Now I'd like to share some school-specific news about preventing the spread of COVID-19. Our custodial staff regularly clean classrooms and common areas to safeguard student and staff health. Custodians and bus drivers use products effective for addressing coronaviruses on surfaces. Custodians keep soap and hand sanitizer dispensers stocked. Students may bring hand sanitizer from home, though we emphasize that proper hand washing is the preferred method for avoiding the spread of germs. We instruct employees and ask them to remind students to keep their hands clean, avoid touching their eyes, mouth, and nose, cover coughs and sneezes, and please stay home when they are sick. When schools are open, healthy students and employees are expected to be in school and at work. Because the CDC advises healthy individuals not to wear face masks unless their healthcare provider recommends it, we are asking that students and employees not wear a mask unless instructed to do so by their healthcare provider. Also, as we know that the coronavirus has been in various countries, I ask everyone to avoid stigmatizing people of any specific ethnicity or background. Viruses do not target people from specific populations. School counselors are available to assist students experiencing any anxiety. FCPS provides an employee assistance program for staff, and we encourage community members who are anxious about the coronavirus to call 211. Thanks again to Dr. Brookmeyer for the important information she shared with us about minimizing the spread of COVID-19. To keep our community informed on this matter, we post updates online at www.fcps.org/update. I encourage viewers to visit the FCPS website for answers to frequently asked questions and information about actions you can take to promote good health. Remember to avoid the spread of rumors, and please use reputable sources. Our site has links to the Frederick County Health Department, the Maryland Department of Health, and the Centers for Disease Control and Prevention.